Good evening and welcome to this special briefing and webinar with myself, Councillor Waseem Zaffar, and Dr. Justin Varney, who's the Public Health Director for Birmingham City Council. And the special briefing, it'll come to no surprise for anybody, is around COVID, the continuing challenges that we have with COVID, the pandemic, some information about the vaccination program. We will be focusing largely on Lozells, the area of Birmingham that I represent, but a lot of the information will be very relevant to communities right across the city of Birmingham and actually communities right across the country. Justin, good evening.
Good evening, Councillor Zaffar. Good evening, Lozells.
Thank you for joining us. Now, Lozells has unfortunately been one of the areas of Birmingham that's been at the top of the charts when it comes to COVID. I think early on I described it as the epicenter of coronavirus and COVID-19. And then when we last had this discussion back just before Christmas, I think the numbers were something in the region of 785 per 100,000, and that was top again. And then we had a really concerted effort of messaging and providing advice to businesses and residents of Lozells, and a bit of enforcement action too. And very quickly, in a couple of weeks, we reduced the numbers substantially. But with the new strain arriving in Birmingham, again, unfortunately, Lozells has reached the top of the charts. And Justin, can you tell us what the latest numbers are for Lozells and the latest numbers for Birmingham, please?
So for Lozells, that over the week running up to the 8th of January, so over the 7 days up to the 8th of January, there were 135 new cases in Lozells ward, and that gives a case rate of 1,379 cases per 100,000. And that compares with the kind of best in the city in the same week, which is Bournebrook and Selly Park. They had a case rate of 336 per 100,000 population. So that's the kind of span across the city. The overall case rate for the city in that week was 800, and I'm just double checking it for you now as I go up my screen. Yep, 806 cases per 100,000. So you can see across the city there's quite a spread, but Lozells sadly is staying up in the top 10 at the moment. And we really do need to bring that case rate down, because we're now starting to see in our hospitals what happened just after Christmas when the case rate started to rise. And if it keeps on going up, the NHS is just going to get in ever more trouble.
We were talking off camera just before we started this program about Lozells and sort of the demography of Lozells. And part of the challenge is it's one of the most densely populated areas in Birmingham. And you've also got multi-generation households. And with the new strain, as a layperson, as not as a professional, I get the impression once COVID and the new strain enters a household, it's very difficult to stop it spreading across that particular household. Would you agree with me, Justin, on that?
Yeah, I mean, the new strain is more infectious, and there's two reasons for that. So one, when people have got the new strain of COVID, there's more virus in their body. So when they breathe out, each of those little droplets has a lot more virus in it. The virus itself is also more sticky. So when it lands on our cells, it's much harder for our body to just brush it off and ignore it. It really clings on tightly and infects the cells. So that does mean if someone tests positive in your house, please, everyone start wearing masks at home. Don't share a room with people who are positive. Open your windows when the person who's positive has been in the room before you. Ventilate the house. That will help reduce the spread. And please keep washing your hands regularly, especially if you're passing things. Please don't pass a plate of biscuits and blast COVID with it. These are all simple things we can all do that will help protect each other if we're sharing a house, particularly if we've got elderly relatives who live with us.
Great. I just want to say to the viewers, if you've got any particular comments or questions, do put it into the comment section, whether you're watching on Facebook or on YouTube. We can see the questions appear down the side of our screen, and we'll be more than happy. I'll be more than happy to put them to Justin on your behalf. Justin, obviously, one of the key things is testing. I remember the World Health Organization at the very, very start of this pandemic saying that the way out of this is testing, testing, and testing. So, what is the current testing regime in Birmingham? And I know we've got different sort of testing. We've got home testing, we've got walk-in test centres, drive-through, and we've got other testing centres as well. So tell us a bit about how testing works, and if somebody does have symptoms, what's the best way forward for them?
Okay, so there are two types of testing. One if you've got symptoms, one if you haven't. So let's start with if you've got symptoms, you ring 119 or go onto the NHS website and book a test. The test involves doing the swab, so it's that long cotton wool bud goes up the back of your both nostrils and the back of your throat to tickle your tonsils. That then gets sent off to the lab, and they do a thing called PCR, where a machine looks at very small bits of the virus, and that will tell you if you're infected or not. Now, the second type of test is the lateral flow test, and we use the lateral flow to look for people who are infectious but may not have symptoms. It's the same swab. I'm afraid you don't get out of the swab either way, back of your nose, back of your throat. But instead of going to the lab, at the testing centre you go to, the test assistant will take that stick, they'll mix it with some liquid, drop it onto a little testing kit, and just checking, I think I've got one with me here to show you. So it looks a bit like this, if you can see that. And they drop the liquid into the little well at this end. And then within 30 minutes, they have to read it to give the result. And the result then gets uploaded to NHS Test and Trace, and you get the result texted through to your phone. Now, lateral flow, because it's only this bit of plastic with some special paper inside, can only really find the virus if there's a lot of it in your nose and your throat. So it's very good at finding if you're infectious, but it's not very good at finding if you've just caught COVID and you're in the early days before you're starting to get lots of the virus in your body. So that's why we use them differently. Lateral flow for people that haven't got symptoms but still have to leave home, and that's why we're recommending to use it. And you should be testing every 3 to 4 days if you've got a job you can't do from home. PCR, if you've got symptoms, ring 119. Lateral flow, go on the council website. We've got testing sites all over the city. Most of them are booked appointments, but obviously the National Indoor Arena, you can just turn up between 8 and 6 every day. And as long as you've got some ID, you can get a test within 30 minutes there.
Great. And just to repeat, so what are the timescales for the tests, the home testing kit and the walk-in testing?
Yeah.
So I remember the days, sorry, Justin, I remember the days when I remember my son had to come home because he wasn't well, and we had to get him tested. And I was getting things like, I think the first test offer we had is in place in Oldham or somewhere like that. But I know that's improved substantially. So, we got tested last week. We got a test within hours, and the result came back quite quickly. So he has improved substantially, hasn't he?
Yeah. So for symptomatic testing, ring 119 NHS website. We have 12 testing sites across the city. There are 2 drive-through sites. So one of them's down in Longbridge and one of them's over in the kind of Aston region of the city. And then we have another 10 walk-through sites. And I think the one that's closest to you is probably still the Villiers Street site for walk-through appointments. You have to have an appointment, so please don't turn up at those sites without an appointment. Generally, people are getting the results from those tests within 24 to 48 hours. Varies a little bit. And in most of those sites, you can actually get an appointment the same day at the moment. So if you have symptoms, get on the phone or get on the website, book yourself in, get a test, and you'll normally get a result for that within a day or two. The lateral flow, obviously, you can just turn up to the NIA. As far as I know, so far, no one's had to wait more than half an hour to actually get the test done. The test itself, your bit of the test, the swabbing bit, takes about 10 minutes. And then you'll get a result through to your phone, either by text or email, normally within an hour. By the time we've read the result, uploaded it on the system, and the system sends it back to you. You can wait on site if you want at the NIA, but the other sites, they ask you to leave and just wait for the text.
Great. Just coming back to Lozells, we've had some issues around businesses and that shouldn't be open. Let's be absolutely blunt. I had to speak to the officers around enforcement at the council who liaise with the police to shut down 1 or 2 businesses that absolutely shouldn't be open during this pandemic. And then we've also had officers going around advising some of the businesses around the sort of guidelines and the safety measures, COVID safety measures within their businesses. What advice would you have for businesses to ensure that they're protecting themselves, their staff, and also protecting their customers?
Yeah. So first of all, there's lots of information for businesses on the government website that's business specific. So if you're a restaurant, obviously the advice for someone in the kitchen is quite different from, say, you're a post office or a parcel logistics company or a manufacturer. So do have a look on the .gov website, because there's very specific guidance for different types of businesses. But in general, only bring in people to work who absolutely need to be there. If someone can do their job from home, please keep them working from home. It's much safer for them. It's much better for you as well. If they are coming into work, 2 meter spacing, face coverings. My advice is to start wearing face coverings all the time. If you're inside a building you don't live in, just wear a face covering and keep it on the whole time. But particularly if people are moving around a building, a workplace, that's really important. They've got face coverings on. Ventilate the space as much as possible, and have hand sanitizer stations dotted around. The other ask, and this is a very Birmingham thing we're asking for at the moment, if you are bringing your staff into work, please help them get a lateral flow test every 3 to 4 days. Preferably if you can get them to the national arena, because we've got the most capacity there, which for Lozells is not that far away. So I'd encourage you to use that rather than some of the others. If you're a very large employer with over 100 to 150 staff, talk to the council and we can help you set up a testing site on site for your staff. But that's the final thing I think now, to really ask businesses to make sure they're doing their bit to help staff that have to come into work to get a test regularly.
Great. Just moving on slightly to the vaccination program. I think today the government announced that 3 million people across the country have been vaccinated, and I think the West Midlands or the Midlands features quite high in those particular figures. I've been liaising today with the Sandal West Birmingham Clinical Commissioning Group, the CCG, which is working with NHS England on the vaccination program in the Lozells area, which is the West Birmingham area, and that's why it's with that particular CCG. I know the Birmingham Solihull CCG is working in the rest of Birmingham and across Solihull too. So there's a lot of work taking place, a lot of people being vaccinated, and there are plans in place to really increase vaccinations in the coming weeks. So, Justin, I know you're not leading on this, and other colleagues in the NHS are leading on the vaccination program, but you're very, very close to the situation. So, do you want to share what's happening with the vaccination program?
Yeah. So, first of all, I want to say that the vaccine is rolling out. Of course, it's taking time. We have not done this kind of mass vaccination ever. So to put it, this is similar to when we were evacuating children during the war, in terms of how complicated and how big the scale of what's going on is. This is the biggest peacetime effort in the world ever. So it isn't going to go smoothly from day one. And what I'd ask people to do is be patient. The GPs are working really hard that as vaccine becomes available, they're standing up testing sites in primary care. Obviously, we've got Millennium Point, which is brilliant. If you do get a letter to invite you to go to Millennium Point and you're able to go, then I would say please take that opportunity. If you aren't able to get there, then please wait. Your GP will be in touch as soon as a local site becomes available. Similarly, they're also standing up a service to help people that are housebound, and that's based on people we know are housebound already. So every GP has a list to know which patients always need a home visit and can't come into the surgery. That's what will be used for the housebound patients, and that will start to roll out over the next week or two as well. It is important people understand what we're doing with vaccine at the moment. There is still a limited amount of vaccine in the country. We are giving it to people to reduce their risk of dying if they catch COVID, and to reduce their risk of catching COVID. So we are vaccinating to prevent death rather than vaccinating to prevent transmission. So when we've got lots of vaccine, that's where we'll be trying to get herd immunity and stop the spread of the virus. What we're doing when we've only got a small amount of vaccine is offering it to the people who are most likely to die if they catch COVID, and to those people who work with them in very close contact, like doctors and nurses and care assistants. So at the moment, we are vaccinating to stop people dying. And that's why if you are lucky enough to be offered a vaccine, I'd really ask you to take it. It's safe to take. Now we've got millions of people that have had it safely. The only major contraindication, the only major reason not to have it is if you've been extremely allergic to a vaccine before. We now know it's safe to give to people who've got allergies to insect bites and all of that. That's been resolved. And the GP will talk to you about what your options are if you are in that special case. But please, if you are offered it, take it. It's there to help save your life and to stop you ending up in hospital and to stop you dying. So please, please take up the offer if you're lucky enough to get a letter.
Can I absolutely endorse that? If you are offered a vaccine, please do take it. Every few hours I get a telephone call from people asking me for advice on whether they should take a vaccine or not. I'm not a health professional. I'm a layperson, but from all the information I have is that this vaccine is very, very safe to take, with the exception of the allergy reference that Dr. Justin Varney just made. I know there's people out there who are discouraging their family members from taking it. There's all sorts of conspiracy theories out there, but please, come on, folks. We're in a very, very serious situation with this pandemic, and this is about saving lives. So please do take the vaccine if you offer the vaccine. And Justin, I know that just coming onto the fake news and the conspiracy theorists out there was a lot of conspiracy theories around COVID initially. Some of that now is following through on the vaccine. And I find it horrific. I find it hugely disrespectful. I see people posting stuff on social media and posting on WhatsApp false information and fake news about the pandemic, about the illness, about the vaccine. And these are the same people. Some of them have suffered from this illness themselves. People have seen ambulances parked outside their houses. They've lost their neighbors. They've lost their family members. Yet they're stubborn enough to admit that they're actually wrong. And this is a serious, serious illness that we are all fighting. And not just people here in Lozells or Birmingham or across the country. It's a pandemic that the whole world is fighting. And we will continue to fight for some time. So, Justin, fake news, how can we address it? And what, I'm sure that there's been conversations with the government and others about how we can influence some of the, and this isn't about muzzling free speech, but this is about getting factual information out there. How can we work with the social media providers to ensure that some of this rubbish that's out there is not shared?
Well, I think that the challenge is that, COVID deniers, anti-vaxxers, how to put this politely, have loud mouths and know how to use social media. And I think we are seeing more and more international business on social media start to clamp down on fake news and using things like fact checkers and stuff. But I also would say to everyone watching, we've all got a responsibility not to pass it on. I would strongly advise not to have an argument with these people. They live in a world in which that's their reality. And all you do when you argue with them on social media is drive them up the algorithm so more people see them. Block them and ignore them. If they're your friends, have a quiet word and say, if that's your opinion, I respect you have that opinion, but please don't share it with me or my friends because we don't believe it, and actually it's undermining what we're trying to do to save lives at the moment. And instead pass the truth. Follow us on the Healthy Brum social media accounts. Sign up as a COVID champion. I know loads of people in Lozells have already after we last met, Councillor Zaffar, which was brilliant. Play your part in getting the truth out and don't pass the rubbish on. If it is not branded properly, if it isn't coming from a legitimate source, then just delete it and let it go, because that's the easiest way to kill the fake news, is not give it the airtime and not give it the attention.
Thank you. In a minute, we will be bringing in some of the comments and questions. I know there's quite a few, but I just want to touch upon a meeting, Justin, that we had earlier today. Colleagues from Lozells, particularly Saidul Haq, who unfortunately passed positive for COVID in the past few days, wishing him a very speedy recovery, organised a virtual roundtable on Zoom We had nearly 30 what I would classify leaders from across Lazelles. You had all the local schools, so Heathfield, Anglesey, St. Francis, Holt School were represented in the call. You had faith institutions from the New Testament Church of God, Lozells Methodist Church, Lozells Central Mosque, the Will Street Mosque, Dr. Bishop Desmond Jadu from the church that he's affiliated to on Lozells Road, a number of other health leaders from religious leaders, faith leaders. You had the St. Silas Church, so you know, a whole host of folk, and a number of community groups too, Aspire and Succeed, and many others. And it was really pleasing to see that everybody was committed, and the police also joined this call as well. Rob Capella and his colleague Sam from the local police team. Everybody was committed to working together to get some key messaging across to households. And I would estimate that the vast majority of the household, and by the way, we also had some health leaders. We had some local GPs, Dr. Saj, Dr. Saji Sawa, Dr. Sam Mukherjee also joined the call too. So between them, I'm confident that we can, if we get this going and get the messaging going, which is absolutely vital, we can hit the vast majority of households with the right information that will not only counter some of the fake news, but will also ensure that the right information in a number of community languages is hitting the residents in our community. It was, you know, the power of influence within that room and the power of reach within that virtual room this afternoon was brilliant. So there's more to come from that. I think we've agreed to sign off a joint statement. And what that also does, you know, when you get such important institutions that are so closely tied up and connected with the local community, that increases the confidence of the messaging that we're putting out there as well. So, you know, those leaders from the Lozells Central Mosque, Masjid on the call, who said some of the committee members, the elders, have been vaccinated in the last few days, and they'd be more than willing to share information on that. And that will reassure people in our community who are possibly turning down the vaccine because they're not sure, to take up the offer of a vaccine, because it's really, really important. So there was some really good conversations there. And Justin, I know a lot of them have signed up to be COVID champions with Birmingham City Council, and the information is being cascaded, not just in Lozells, but right across the city. So there's a lot of will and support out there to get the right messaging across. And I think that is, talking to the CCG earlier, as I said, that was one of their concerns, how we can increase the level of take-up of the vaccines, particularly in the Black and minority ethnic communities, because that is where we're clearly seeing some refusals because of uncertainty and fake news. Justin?
Yeah, absolutely. And it exactly demonstrates the point. You know, this is why you turning this round, it is about what we each do in our local communities. It's about all of our roles of leadership, and whether that's within your family, whether that's within your friends, whether it's within your online yoga class or your mates from mosque, it doesn't matter. You know, each of us taking the responsibility to share out these important messages. You know, we from the council are providing more messages in more translations as fast as we can produce them. We're working with partners like Citizens UK, like the Chinese Community Centre, you know, like the Bahu Trust, to get messages out to communities in different formats as well. But signing up to the COVID Champions will get you the right information to you to get out into your networks. And the important bit behind that is it's your networks of the people you care about. And you're doing your bit to keep them safe. And that's ultimately what this is about.
Great. Now it's time to bring in some of the questions we've had and comments. So we've had quite a few. And I'm going to try and show them on the screen. So Abu says, I went and had a test done today at Villa Street, I think he's referring to, was very quick and simple. I had a test last week at Villa Street myself, and it was, you know, as I said, very, very safe and very, very quick there, and got the results very, very quickly too. Moving on, Ranjit says, what do you expect the next few weeks will look like in treatment numbers, Dr. Varney?
So I think we're likely to see numbers rise. You know, at the moment we're seeing about 100 cases going into hospitals across the city every day. The modelling that I've seen would push that up to nearer 250 a day, potentially higher. And we are only just really seeing the end of December playing out in the hospitals, and our case rates risen a lot since then. So our NHS is struggling, and it is going to get worse before it gets better. Vaccine is the light at the end of a tunnel, but this is a very long tunnel, and we're coming up to one of the most difficult bits of the journey so far.
I just to say a huge shout out to our amazing NHS staff who've been quite incredible, and they're going through what I would say is the toughest time of their careers. That it is very, very difficult. I'm a non-executive director of Sandwell West Birmingham NHS Trust, which runs City Hospital and Sandwell, as well as others, and talking to some of the senior directors there and some of the staff there, it's hugely challenging, but they're incredibly brave, and they are doing everything possible to support patients who arrive in all sorts of situations. So a real shout out to them on behalf of our community. Next question is from Abdul. Once you have been tested and if found to be positive, what level care is available and how is the patient supported?
So for still for the majority of people, even with the new variant, if you catch it, you may actually not have any symptoms. You may have what feels like a very bad cold or very bad flu. People have certainly told me about feeling very headachy, very achy, having very high temperatures for a couple of days. What I would say is if your symptoms get worse, particularly if you start to develop problems breathing, please reach out for help. Talk to your GP. If it's obviously an acute deterioration, ring 999. But please don't sit at home and suffer. What we see with COVID is that patients do deteriorate quite quickly. And what we saw back in Easter last year was that too many people sat at home and didn't ring an ambulance or didn't ring a doctor because they didn't want to be a bother, or they were scared of going into hospital. And when they did turn up, it was just too late to help them. So there is advice on the NHS website about what you can do to help reduce some of the symptoms. Regular paracetamol, for example, to take down your temperature. Drinking lots of fluids will help. All of those things that we would do for any other infection generally are quite useful here. But if your symptoms do get much worse, please contact your GP, ring 111, or in an emergency, ring 999. Do not sit at home and suffer in silence because this is too dangerous a disease to mess around with.
Thank you. Moving on to the next question. It's again from Abu. What are you doing for the people who are opening their businesses when they shouldn't be closed? I think there was an announcement from the Police and Crime Commissioner, the Western Midlands Police and Crime Commissioner, that they've issued over 1,000 fines, I think it was. And I know the council is also taking very strong action on businesses who are not either adhering to social distancing guidelines or that shouldn't be open. I know from the conversations I've had with Rob James that there's been a few businesses closed in the last few days here in Lozells too.
Yeah, absolutely. And what I would say, if people see businesses that are open that shouldn't be, we know roughly what should be, and it's essential retail, and that's a relatively small number of products, predominantly things like food, pet food, and some other household essentials. Baby clothes, for example, is one of the exemptions. But if you see a premise that's open that shouldn't be, go on the council website. You can anonymously report them. If you see people doing things they shouldn't be, that's where you go onto the police website and report it. And basically, if it's an individual doing the wrong thing, the police have the powers to take action. If it's a business doing the wrong thing, then it's usually the council that have the powers to take the action. But let us know. We can't be everywhere all the time. We've got COVID marshals out knocking on business doors, checking out. We have seen some businesses that have been trying to get sneaky and offering haircuts behind closed shutters. And I have to say, enforcement colleagues and the police have been pretty good at finding them, and sadly had to break down some doors to get in. But if you see it, let us know. That's what that whistleblowing line is for, because then we can go and take action and protect the people that are working that business. Because one of the things that does worry me is businesses that aren't doing the right thing. Often the staff are too scared or unable to challenge that. And that's why we set up this whistleblowing line many months ago now, actually, was really to give staff the opportunity to reach out for help if they're being put in a dangerous situation.
Great, thank you. Just a message to the businesses: don't risk your lives, don't risk your staff's lives, and don't risk the lives of your customers. It's just not worth it. Next question is from Imran. Imran Hussain, can you clarify why we have to wear our face masks on all the time, and is it airborne?
Right, so the reason we wear face coverings, and there are two, this is why I say face coverings rather than face masks. So face masks, that kind of surgical mask that you see in the movies that doctors and nurses wear, that's got special material in it, and that's protecting them from things landing on their face as well as what they breathe out. Now, face coverings, which can be made of any fabric, really, ideally you want 2 to 3 layers of the fabric to help. They're about keeping our own germs close to our face. So they're not about protecting us from anything landing on the outside. They're about keeping our own stuff close to our face. And really what that's about is we know that 1/3 of people who have been infected from coronavirus and are infectious don't have any symptoms. So if they're wearing a face covering every time they go out, it will keep those virus particles close to their face rather than letting them spread around in the environment. Now, the question about whether the virus is airborne or not is a bit of a red herring, because the virus has to be on cells to be able to get around. It can't fly about on its own. So it has to be in those little droplets of water that come out of our nose and our mouth. What we have increasingly seen is in rooms that people are in, if the windows are closed and there's not good ventilation, then those droplets come out of our mouth and they can hang around in the air, not for hours and hours, but they can hang around for a while. And you know how a room feels stuffy if you've all been sat around, and sometimes it gets a little bit funky. That's because all of our particles that we give off are staying in the air. The air is getting stale and loaded with all the stuff that's coming out of our mouths. And when we're infected, that includes the virus. So that's why when we talk about how to keep people safe at the moment, it's adding hands, face, space, and then ventilate. Open those windows, get fresh air in, and that disrupts the particles and it sends them kind of crashing to the floor rather than hanging around in the air. But the face masks and the face coverings, really about keeping your own germs close to your own face and stop spreading them in the world.
Great. We've got quite a few questions to go. It seems really busy tonight. Who is to blame for COVID breaches? ? Dominic Cummings ? So Justin, ignore the Dominic Cummings bit because you're not going to comment on the politics, but who is to blame for COVID breaches?
So I think what we're seeing in COVID breaches is that we are seeing people make mistakes, and we've got to be a bit compassionate with mistakes, but you only get like one mistake, not repeat mistakes, and they forget their masks, and we are seeing more and more shops having free masks available for people who have forgot them, and I think that's a really good move for the people that have just forgotten and made a mistake and put it in the wrong bag. We are sadly seeing some people who are stretching the interpretation of the rules. That's predominantly in businesses, and they're thinking they can get away with it, and that's what comes back to what we were talking about before on enforcement. Sadly, we see some people who are in that slightly strange COVID denial space who think that their party is somehow immune, or their celebration is somehow immune to COVID. And what's really sad about those breaches is generally we do see the case numbers rise. And people who thought they were immune are clearly not immune. So there's lots of reasons why people are breaching. But at the end of the day, each of those people are making their individual choice. So it is about individual responsibility rather than what anyone else has done or said. It's what we each do every time we walk out the front door that makes a difference.
The next comment from Muzib Qazi is linked to the last one. It just does not seem there is a lockdown. People are traveling out and about, and I share your frustration. I see that at times, and clearly we need to remind people that we are in a lockdown and we're in a very delicate situation, probably the worst situation we've been in throughout this pandemic. Ante has asked, with businesses willingly not adhering to guidance, what action will be taken to lower the risk to the wider population? Is enforcement a viable option? So we've touched upon a bit of this, but Justin, just to reinforce the point around enforcement and what action for businesses.
Yeah, so there is enforcement. We've got COVID marshals popping in and having education visits with businesses. We obviously have the whistleblowing helpline on the council's website where you can report anonymously if a business isn't doing the right thing. But most importantly, if you as a customer walk in the front door and it doesn't look like it's COVID safe, walk out, take your business somewhere else. You would not walk into a fire trap, so don't walk into a COVID trap. You know, if it doesn't look safe, if you walk up to a fast food restaurant and there are loads of people waiting at the counter, go somewhere else or order it on one of the online services. Don't put yourself at risk where you see shoddy practice, and report it and let us know so we can do something about it.
Great. Next question is from Naomi Paul. Are adjacent areas like Handsworth in a similar situation to Lozells, RE COVID infection and risk?
So we're certainly seeing, yes, there are similar clusterings. So Handsworth, Holyhead have been up in the higher area, in higher numbers. Newtown's gone up and down a bit. We're seeing quite a lot of clustering in the kind of southeast of the city. The Balsall Heath, Hall Green north and south parts of the city have generally gone up and down together. But it isn't a done deal. And I think that's what's been quite interesting. You know, rates in areas like Perry Bar haven't gone up in the same way they have at Lozells. And some of that might be about population density. Some of it might be about occupation, actually, that we may have more people in Lozells that are working in jobs they just can't do from home. So every day they have to leave their homes, whereas people in Perry Bar may be more able to work from home. We don't know, and we are doing some more work to try and understand that, but there isn't, that data just doesn't exist easily. There isn't an easy database I can go to that says, tell me how many people work in restaurants in Lozells compared to in Ward End. But it's certainly, I think that's one of the big things that's been behind this, actually. It's not about people in Lozells being any better or worse at the restrictions. It's actually the reality of your day-to-day lives that may be just putting you more at risk. And we're certainly now making more emphasis on working with the Chamber of Commerce and the business improvement districts to help businesses get it right. Because if businesses get it right and really protect their staff, then that will protect those of you that do have to go to work and keep you COVID safe.
Great. Next question is from Tomina Chowdhury. How safe is the vaccine to medicine allergy?
Yeah, good question, Tamina. So the vaccine is safe for people who have allergy to drugs like penicillin or erythromycin, for example. That's fine. The only allergy that we worry about really with the vaccine now is if you've had an anaphylactic allergic reaction. So that's the one where your kind of face swells up, you struggle to breathe, and you need the adrenaline pen to a previous vaccination. So it's not that your arm got a bit red and sore, it's that you've had the full-blown allergic reaction. If you have had an allergic reaction to a vaccine before, then your GP will know or should know, because that's one of the most important things that we ask patients about is, have you got any allergies? So if you have had that allergy to a vaccine, then the advice is you can still have the vaccine, but it's normally done at the hospital site, and they'll keep you around for normally half an hour afterwards to keep an eye on what's going on. So there is still a way for you to get the vaccine, but we're much more cautious with those people. Any other allergy, at the moment, that all of that as a restriction has been removed, because we see more and more people get the vaccine now safely, and so they shouldn't be a barrier for you.
Great. Justin, there's so many questions and comments coming in. We're going to be here a while.
I'll try and get shorter.
We were planning to be here for half an hour, but we're going to try and take as many questions as possible and try to finish on the hour. So I'm just looking at people whose questions. Okay, this is a good question. Abu's asked a question, but it's a good question around the major side effects of the vaccine.
So the two vaccines that we have got slightly different side effects. So all vaccines, when we give them to people, we say, well, you may get a bit of soreness in the arm where you've had the vaccine. It's given into what's called the deltoid muscle in the upper part of your arm. You all know I've got a bit of extra padding, so I can't flex it really to show you. But when we give it, we squeeze the muscle, so we make sure it's going in the muscle and the injection goes in up here. you normally get a bit of redness. It's a bit sore for a day or so, and that's completely normal. With one of the vaccines, we often find, I think it's the Pfizer one, people say they tend to get a headache the day after. It's not a particularly bad headache, it's just annoying, and then it goes away. And with the AstraZeneca vaccine, and I might have got these two the wrong way round, but these are the common side effects we see, is sometimes they feel a little bit fluey for about 24 hours, not full on flu, not the shakes, none of that, just feeling that bit kind of slightly muggy, and then it goes away as well. We don't see very serious side effects, but there is a program in place so that when you get vaccinated, you get given a leaflet. And if you do develop a serious side effect, there's a number you call, and that's reported centrally. So we're keeping that monitoring. We do that for all vaccines anyway, to keep an eye out. Do people have serious side effects? So far, I think across the whole country, and I think you were saying it's about 3 million people have had the vaccine so far. There have been, I think it's around 6 or 20 cases of people having acute reactions. And what we've learned from that is they're people who had previously had allergic reactions to vaccines. So that's why they've tightened the guidance on that group. But the most common side effects are either a headache or that slightly fluey feeling for a day or so.
Great. Next comment is from People's Needs UK. Please target the masjids to do Elan in Juma. Elan means announcement, and there was clearly a commitment today. And I know, Justin, just on the mosques, since I think early March, you've been working very closely with Habib and Waqar and others at the council officers, working together with the representatives of a number of masjids from right across Birmingham. And it's been really good engagement, hasn't it? That's been one element of our faith engagement. Then we've also got the engagement with the churches and all the other faith institutions too. So there's good level of support to what we're trying to achieve in tackling this illness from the faith institutions.
Yeah, absolutely. And I'm really lucky, actually, because, you know, they spend quite a lot of time teaching me as well. I meet with the mosques once a week, and I also meet with our Black faith leaders as well. And then I meet all the faith leaders together. So I have kind of 3 faith meetings on a regular basis, and have done since March. I met with the mosques and with the Black faith leaders earlier this week to talk about the current situation. The government guidance is you can continue to hold communal prayer, but that doesn't necessarily mean you should. And I talked through with the faith leaders how they each as individual masjids and churches would reflect on that, go back and revisit their risk assessments to make sure that if they are going to continue with communal prayer, it's safe. But I know that many across the city have made the decision to temporarily suspend communal prayer while we're seeing these very high numbers because of the risk of transmission. But it is a national decision that communal prayer can continue. But I'm very pleased that they are reflecting on this about whether they should continue to do it rather than whether they can continue to do it. It's a very difficult decision. Prayer is such an important part of so many people's lives and important for their mental well-being. But at these difficult times, unfortunately, these difficult decisions do have to be made. And if your masjid or your church decides not to continue communal prayer, I would ask you to please respect that decision and support them. Many of our faith leaders shared the abuse that they had from people where they'd taken these difficult decisions. And I think that's regrettable, to say the least. They are making these decisions to keep their congregation safe. Please respect and support them to do so, and be compassionate about how difficult the decisions are for faith leaders during these times.
Thank you. Question from Javed. Will the COVID vaccination be annual like the flu jab?
Okay, so I'll try and be short one on this one. It depends. And the reason I say that is that the reason we have an annual flu jab is the flu virus changes every year. So it's a virus that does mutate a lot. The COVID virus seems to mutate, but it doesn't change the important bits that the vaccine trains us to attack. So if the COVID-19 continues like it's currently been doing, where it just tweaks a little bit and none of that really changes the immune response, then we should be okay and we won't need annual vaccine. If the COVID virus starts to change radically, then the vaccine will need to be updated, and that's where we might need either annual vaccines or another booster jab. And we just won't know. We know that as we roll out more vaccine against the virus kind of fights back and tries to adapt itself, and that's normal. But in general, it never learns how to overcome the vaccine created immunity. So fingers crossed, it will just be 2 jabs, but we really won't know probably until this time next year whether the vaccine's really is able to carry us through, or whether we'll start to need having annual ones. If we do, because we've already got one COVID vaccine, to do a new one on a variant is much easier, much faster, and will be much quicker to roll out.
Right. A question from Miss UK Saeed. Can they please start asking people in our area why they are outside? Too much traffic and people walking about. In terms of traffic, I was briefed earlier this week as a cabinet member for transport that we estimate that traffic levels are something in the region of 70% of pre-COVID levels, which is far too high for a lockdown. They did go down to about 35% in the first lockdown, the first big lockdown we had in May, June. But I am concerned about the number of cars out there currently. In terms of whether the police can ask these questions and ask why people are outside, I think there is real issues of resources too. They're doing an incredibly difficult job, and they're doing it really, really well with the very limited resources that we have. So we've got to be careful of what we do request from the police. Next question from Javed again. Which vaccine is being offered, the Pfizer one or the Oxford one?
Both. So, but they won't both be offered to the same person. So when you get invited for your vaccine, the person who consents you for the vaccine, so when you get asked to come, you turn up, they ask your name, date of birth, all of those details, and they will explain to you which vaccine you're having and ask you to consent. Now, what you don't get to do is go, I don't want the Pfizer one, can I have the Oxford one instead? Because they'll only have a supply of one type of vaccine in the vaccination centre. The difference between them in terms of side effects is minimal, and in terms of protection is minimal. We only have a small amount of these vaccines available at the moment. So please take what you're offered. It has been tested. We are confident it is safe. And please don't let it go to waste.
So here's a question from Denise Whitaker. I am concerned about vulnerable homeless and HMO residents in the area and how to get across basic messages to them re compliance with COVID-19 protocols such as mask wearing and social distancing.
Yeah, really good point, Denise. So we're working with the homeless providers across the city. We have done for many months now. Actually, it was one of my very last face-to-face meetings I had before lockdown was with our homeless partnership to support them. I've done a couple of Q&A sessions like this with homeless peer support workers. The council's also been able to secure some extra money. So we've put additional face coverings and hand sanitizer into our homeless hostels across the city and into some of our HMO settings as well, to provide free to residents to help them keep themselves safe as well. So it's something we're very aware of and we continue to work on.
Next question is from Shahid Ali. If you have had COVID and recovered at home, would you still recommend people to get the vaccine, or will you be okay?
Please still get the vaccine. We know that natural immunity only occurs in about 2/3 of people who've had the virus. And even in those people who do have natural immunity, their body forgets after about 4 to 5 months how to protect itself. And we know they can then get reinfected. We also know that of those 2/3, about 1/3, the immunity they develop just doesn't work properly either. So just because you've had it once doesn't mean you can't have it again. And we have seen quite a few people now who've got infected twice. And so what we also know is if you have had it, even if you develop natural immunity, if you get given the vaccine, it doesn't give you any greater side effects or any greater reaction. Think of vaccination a bit like setting your body a test. And you get 2 doses because one's your GCSE and one's your A level. GCSE level, we're pretty competent. We could do an equation if we really had to. If we did A-level maths, we'd be able to do it without having to think about it for the rest of our lives. And that's how vaccination works. So really, if you've had natural immunity before, it means you've probably done your 11 plus. You still need to do your GCSE and A-level.
Great. Next question from Muzib again. Are there going to be stricter border controls at airports? I think things have slightly changed at airports, haven't they, recently?
Yeah, I mean, these are national decisions, not local ones. And I was on a call earlier today, a national call, where that was discussed. I think UK government continues to look every day pretty much on should it be stricter. It's not as easy for the UK as it is for countries like Australia or New Zealand to lock down our borders. We have so much coming in and out in terms of trade that we're really not that self-sufficient. So it is more complicated than we might all think. But I have to say, anyone who's tried to get a holiday at the moment, you can't really get tourist trips from many countries. So it's almost naturally coming to a halt.
Okay, there's some kind messages thanking us for this initiative. Lord Wajid Khan, who's also the Mayor of Burnley, Rayan Khan, Anthony Joseph. Let's take this one. I'm conscious about time. Sorry if I missed this earlier. Are there any recent guideline updates on places of worship? From Deverton Douglas.
So I think that might be Bishop Douglas, who was with me earlier in the week, actually, in the call with the Black faith leaders. Forgive me if I got that wrong. So the advice for faith leaders is please consider carefully whether to continue with congregational prayer. If you are, then use 2 meters as your guide rather than 1 meter plus. Please ensure face coverings are worn, hand washing, and please ventilate faith settings regularly, because that will also reduce the risk of transmission. But we should all be thinking very carefully at the moment about whether we should bring people together, even if we can, under the current guidelines.
This question from Muhammad Rahman. Would it be good to give the vaccine numbers taken across worldwide? The statistics that I have seen show the unwanted reaction is extremely low.
Yeah, I think we will start to see that from the World Health Organization over the next couple of weeks. One of the challenges that we have for worldwide stats is that every country kind of collects its numbers in its own way. It's one of the reasons we find, for example, death statistics so hard to compare between countries, because everyone counts the numbers differently. But I know the World Health Organization is looking at this at the moment. And I think we will see more of it come through quite soon, because actually when you look across the wall at across the world, the millions of people who've now had the Pfizer vaccine, at least, we know that the number of reactions and the number of deaths is absolutely minuscule. And that's a really important message to get out, as Mohammed suggests. So I'm hoping it will come soon, and I know it's being worked on.
Another good question from Denise. Can someone with an underlying autoimmune disease have the vaccine?
Yes, because none of the vaccines are what are called live vaccines. So people with autoimmune conditions can't have some of the vaccines that have live vaccine in them, because their body might not be able to cope. But none of the 3 that have been approved, the Moderna, the AstraZeneca, or the Pfizer, are live vaccines. So they are safe for people who have autoimmune disease. And there is no evidence of people with autoimmune disease having any form of different reaction to the vaccine as it's being rolled out.
Great. Henna Roy, need to get as much, I think as a typo, info shared RE vaccines and availability, particularly for those with medical vulnerabilities and in shielding. Absolutely agree with that. From Tamina Chaudhry, I had a DRESS syndrome because of, oh God.
Sulfasalazine. It's a drug. Yeah.
Okay. I'm not the doctor. He's the doctor.
Yeah. So Tamina, yes, I think it is. What I would say is Birmingham and Solihull CCG have set up a really good vaccine website. The West Birmingham CCG are working with them at the moment to just add in the extra West Birmingham information about where the vaccination sites are, because that's the only bit of info that's different. But it's got a lot of FAQs on there in real detail, and the council's worked with the CCG to feed into this. So do have a look on there, because it's got the very detailed what's in the vaccines and the 2 different types, and those are the components that if you have an allergy to them, then you've got to be a bit more careful. But sulfazine isn't one of the components, so you should be fine.
And this will be the final sort of comment we take. It's from Iftikhar Qazi. Despite the current lockdown, I have noticed people in my area are not wearing a mask, and in supermarkets, takeaways, people are not adhering to social distancing. My area is the 3rd worst affected. And I think it's a good one to sort of finish on, because that is part of the real challenge, and part of the reason we've been trying to have this briefing and webinar is to remind folk about the importance. And I think each and every one of us need to take responsibility for our actions, which will obviously impact on how we protect ourselves, how we protect those that we live with, our family, our friends, and those we come across when we are out for essential reasons. So, please do follow the guidelines. They're absolutely vital. And, we've seen too many people who've unfortunately not adhered. Some of them, not all of them, some of them have, it's just one of those things. But for some people, they've not quite followed the guidelines, and they've ended up being seriously ill. And we want to try and avoid that as much as possible. Justin, any final words from you?
I suppose final words from me to say is, first of all, thank you for joining us. This is exactly, and thank you for Councillor Zaffar for organising this. The decisions we each make every day are the decisions that bring this disease under control. How we each go about our daily lives, but more importantly, how we encourage the people we love and care about to play their part, and we work together to protect each other, is what makes the difference. So please take the information you've heard tonight and share it with the people you love and care about, and play your part. We are going to enter some of the darkest days we've experienced in this pandemic over the next coming days and weeks. There is light at the end of the tunnel, but the journey towards it is still, I'm afraid, very long. Please be compassionate with each other during these times. Everyone's tired, particularly those of us in the public service who've worked tirelessly to keep you safe and doing the best that we can. But please work with us to play your part in bringing this disease back under control, and trying to save more lives.
Dr. Justin Varney, thank you so much for joining us this evening. You've been a regular visitor to Lozells remotely since the pandemic started. We really appreciate your information. We appreciate your openness and transparency in sharing some of the crucial information and some of the challenges that we've faced, and the challenges have evolved over time. I want to say a big thank you to each and every one of you who joined. People have put questions and comments. I think we've taken the vast majority of the questions and the comments. There might be one or two that we've not taken. Hopefully you'll join us in the future when we can come back and share some good news about how together we tackled this pandemic, and together, we protected our communities. This is, I'm guessing, the most difficult time of this pandemic. It's really, really important that you protect yourselves, you protect your families, you protect the people around you, stay safe, wash your hands, cover your face, socially distance, and importantly, when you are offered the opportunity of a vaccine, I'm waiting. I've got underlying health issues, and I'm waiting for that crucial call where I'll be invited for a vaccine. And I would strongly encourage you, whether you're suffering from underlying health issues or not, whenever you are offered a vaccine, please take up that opportunity to take that vaccine. That is the light at the end of this tunnel, and that is what will get us back to some form of normality in the near future. Thank you again. Hope you have a great evening, and hopefully we'll see you again in the very near future.